Jennifer's story.
This again,
have you ever heard the word?
3 minutes. So the whole idea this evening is, I know I'm going to be the last speaker, and I don't have an aura as the other speakers out here, so I will have to show you things that are far more attractive than this individual here. So let's go back to the presentation. Give you a very, very clear perspective. If we improve the access, availability, and affordability of healthcare services in India, it is directly proportional to improving the quality of life and the economic and social development that Mr. Srinivasan spoke to us this afternoon. Very, very basic numbers. India is home to 61 million diabetics. Focusing on these numbers because the innovation that we created are to tune these numbers. 61 million diabetics, we are very soon going to become the diabetes capital in the world. So you pick up anybody from 4 individuals the world over, one of them would be, the diabetes guy would be from India. Hospitalized Indians spend on average about 58% of the total expenditure, income and annual expenditure. 40% of hospitalized Indians borrow heavily, or a lot of them in rural India sell their assets for their healthcare services. Over 25% of hospitalized Indians fall BPL, below poverty line, each year. So what's the vision? What is it that we thought we must do? We want to ensure untimely deaths due to non-communicable diseases, diseases that really don't speak out to you, like diabetes, cardiac arrest, so on and so forth. The idea is to help prevent the non-poor from entering into poverty, or to try and see that people who are already below poverty line do not get down further. So what did we do? The next slide. We used a very innovative approach. The idea was, we realized through a survey after working with IIT Mumbai and IIT Delhi, that a lot of people in rural India are not getting themselves checked on a regular basis, which is diagnostics. Because either the semi-auto analyzer, that's the machine that they use in primary healthcare center, does not work, or they don't have manpower, or very simple, it's too expensive, or 4, I don't think I'm really sick, though then me theek ho jayega. You know, I'm going to get okay in about 2 days. So blood test is not being undertaken. What did we do? Forget the model, look at the suitcase. Next, stop. Go back. Yeah, so this is what we did. So the whole idea was, blood test has to be done for the rural poor in rural India, outside the doorstep of the rural poor. So what do? You can't set up a lab everywhere, you take the lab to that individual. So here is a mobile lab, a lab in a suitcase, it's battery operated, can be recharged, connect to your computer, the data can be transferred anywhere in the world. In less than 3 rupees per individual per test, over 23 different parameters can be taken. So you want to take a glucose test, I can bring that suitcase right here, take a test for you, 15 minutes, you know what your problem is, whether your blood sugar is high, low, blah, blah, blah. 23 different parameters. So yeah, how does this help? Regular monitoring, master health checkups in rural India, preventing non-communicable diseases. At INR 3 per test per patient, you reduce the out-of-pocket expenditure. So this is innovation in a way. There is a problem. We wanted an idea, we created an idea. The idea was to bring out a whole lab, which is this large, into a suitcase and ensure that it has battery-operated functionality because of power issues in the country. Saving of travel cost, quicker start of treatment, evidence-based medicine. So the doctor now knows what this guy is suffering from. There is a problem in rural India today, and that's called symptomatic treatment. There are foundations all over the country today which are going to rural India with a nice fancy bus or a car or a jeep which has a doctor. The doctor goes, kya problem hai aapko? I'm coughing for the past 3 days, here is a medicine for cough. And boom, they have an annual report which says every day we treat more than 50 patients. And that guy, poor guy, is coughing for the past 3 months, converted that into tuberculosis and he's died. That does not come in the annual report of that particular foundation. So these are the tests for those who understand what the tests are. Okay, what is innovation 2? The idea was, while there is an opportunity of getting into a village and getting the test done, there are times when we still need a specialist doctor to see them. In India, there is a 70-30 or an 80-20 principle. More of a 70-30 or an 80-20 principle where you have 80% of the doctors who are treating the 20% population in urban India and 20% of the doctors vice versa. So people, specialist doctors, cardiologists, gynecologists, pediatrics do not want to go into rural India because it's not fancy, doesn't allow them to make a lot of money. That also springs from the education system that we are in. Incidentally, the topic was, they wanted me to speak more on health and education together, but I wouldn't be able to do justice to both of it, so I stick to health at this moment. Give you an opportunity to invite me back again for education. That's marketing. Okay. So this is very, very simple. The myth says it all. There's a guy who's sitting down somewhere. We have the probes attached to his body. We want to take an ECG. And there's a nice, fancy, suited, booted doctor who's in, say, holidaying in Munnar in Kerala, and he wants to know where the data is. The ECG can be transferred to his mobile phone. Let's run through the video. So I don't really have to talk about telemedicine. This 2-minute video says it all.
This is Jennifer's story. Have you ever heard the words telehealth or telemedicine and wondered what they meant? Maybe it's a new kind of medical telephone or some new TV show about a hospital. Instead of trying to define these terms, it's best to describe what they mean with stories about real people. Meet Jennifer. Jennifer is 5 months pregnant and lives in a rural area in the American South. At one of her first doctor's visits, Jennifer was told that her pregnancy could be high risk. She would be monitored more closely than most pregnant women. This means more doctor's visits, more tests, more traveling from her small town, and more time away from work and family. All of this adds up to more money. Now meet Dr. Allen. Dr. Allen works at a regional health clinic 15 minutes away from Jennifer's home. Dr. Allen is a family practice physician and sees all types of patients. Dr. Allen isn't specialized in high-risk pregnancies, but there's a tool at his office that can help Jennifer and her family. The tool is a video conferencing unit. Video conferencing allows two people to communicate in real time over long distances. Sounds like a telephone, huh? Yes, but video adds the face-to-face element that a phone cannot offer. Video conferencing also allows users to send high-resolution medical images back and forth in real time. Okay, back to Jennifer. She has an appointment to see her doctor in the capital city of her state, which is 2.5 hours away. Instead of missing work, finding babysitters, filling the car up with gas, and maybe even staying in a hotel, Jennifer can drive to a regional health clinic and see her doctor in capital city over live video. The doctor can see Jennifer, look at ultrasound images, and direct her care with the help of healthcare workers by Jennifer's side. All this is accomplished by video conferencing equipment and high-speed internet lines. Jennifer doesn't have to take time away from work or time away from her family. Jennifer gets more specialized care, cheaper and faster. That's telemedicine. This video produced by LearnTelehealth.org, a part of the UANMS Center for...
Okay, so what did we do? This is more of an American example, but we then took that American example, tweaked it to suit Indian conditions. The last line that they mentioned was it works on a system with high-speed internet connection. That definitely does in the US. We don't have high-speed internet connection in the last mile connectivity in India. I'm sure our experts on telecom will say that. So we created a system which has 2 SIM cards enabled inside. The next slide. So these are the things that it does. It has got 2 SIM cards enabled inside. If one doesn't work, the other one works. So if there is no BSNL connectivity there, an Airtel would work or a Vodafone would work. It works on 2G connectivity. We don't need a 3G connectivity. The data can be transferred to the mobile phone of a doctor. Another innovation that we did going forward was integrated the ECG machine and the blood machine. So a patient walks in, takes his blood test, goes on, takes his ECG, takes his blood pressure, oxygen saturation, and body temperature. Data is transferred to a doctor. In less than about half an hour, the patient knows what he or she is suffering from. The medicine is given at the village level, and he or she goes home. This is how the ECG looks on a mobile phone screen. Okay, so you guys, I mean, you are the IAMs of the world, so you know what benefits it would offer. There is one particular video which I keep watching every time, and I think I've kind of finished the time allotted. I'll be happy to talk to you over a cup of coffee because I have enough time by the time I leave this campus. But there's one video which has laid a very, very strong impact on who I am and what I do today. And whenever I feel a little low, I watch that video and I feel that character in the video speaks out to me. And if you could play that, it's a fantastic video.
I'm sorry, but I don't want to be an emperor. That's not my business. I don't want to rule or conquer anyone. I should like to help everyone if possible. Jew, Gentile, black man, white. We all want to help one another. Human beings are like that. We want to live by each other's happiness, not by each other's misery. We don't want to hate or despise one another. In this world there's room for everyone. The good earth is rich and can provide for everyone. The way of life can be free and beautiful. But we have lost the way. Greed has poisoned men's souls, has barricaded the world with hate, has goose-stepped us into misery and bloodshed. We have developed speed, but we have shut ourselves in. Machinery that gives abundance has left us in want. Our knowledge has made us cynical, our cleverness hard and unkind. We think too much and feel too little. More than machinery, we need humanity. More than cleverness, we need kindness and gentleness. Without these qualities, life will be violent, and all will be lost. The aeroplane and the radio have brought us closer together. The very nature of these inventions cries out for the goodness in men, cries out for universal brotherhood, for the unity of us all. Even now, my voice is reaching millions throughout the world, millions of despairing men, women, and children, victims of a system that makes men torture and imprison innocent people. To those who can hear me, I say, do not despair. The misery that is now upon us is but the passing of greed, the bitterness of men who fear the way of human progress, the hate of men who will pass and dictators die, and the power they took from the people will return to the people, and so long as men die, liberty will never perish. Soldiers, don't give yourselves to brutes, men who despise you, enslave you, who regiment your lives, tell you what to do, what to think, or what to feel, who drill you, diet you, treat you like cattle, use you as cannon fodder. Don't give yourselves to these unnatural men, machine men with machine minds and machine hearts. You are not machines, you are not cattle, you are men. You have the love of humanity in your hearts. You don't hate, only the unloved hate, the unloved and the unnatural. Soldiers, don't fight for slavery, fight for liberty. In the 17th chapter of St. Luke it is written, the kingdom of God is within man, not one man nor a group of men, but in all men, in you. You, the people, have the power to create machines, the power to create happiness. You, the people, have the power to make this life free and beautiful, to make this life a wonderful adventure. Then in the name of democracy, let us use that power. Let us all unite. Let us fight for a new world, a decent world, that will give men a chance to work, that will give youth a future and old age a security. By the promise of these things, brutes have risen to power, but they lie. They do not fulfill that promise. They never will. Dictators free themselves, but they enslave the people. Now let us fight to fulfill that promise. Let us fight to free the world, to do away with national barriers, to do away with greed, with hate and intolerance. Let us fight for a world of reason, a world where science and progress will lead to all men's happiness. Soldiers, in the name of democracy, let us all unite!
I would like to extend an open invitation. I'm happy to unite with even that one single individual who comes out of this particular campus who says, I don't want that 50 lakh or 1 crore job, but this is what I want to do. I'm happy to shake hands with you. Thank you.